Hello, everyone, and thank you for joining us wherever you are. It would be difficult to imagine a topic of greater relevance and urgency, and we have a great panel today of uniquely qualified experts. Just a few housekeeping rules to get out of the way. We'd love to receive your questions via the chat function, so please specify your name and the speaker you would like to address. The session is being live streamed by Bloomberg and also recorded by YouTube. Just a few words about S8. We're a community of distinguished officials from outperforming innovative nations, smaller nations. Richard, you need to put this, need to put my slides up 1 second. So again, we're just a community of distinguished people from outperforming innovative smaller nations. The spirit was to come up with a kind of pendant to the G7 or the G20. It's not easy being a large nation these days. There's a lot of negativity, blaming, complaining, divisiveness, but progress, as we know, is not about finding things that don't work, but finding things that work and reverse engineering. And today we'll learn about that in the case of Israel's phenomenal experience with their vaccination program. And there are lots of success like that out there, but the problem is that the signal ratio to noise ratio is increasing by the day. And we have to have the curiosity and the courage to look over our garden hedge and see what others are doing. S8's focus is on excellence, not size. It's about leading and learning by example. The most severe problems we're dealing with, things like pandemics, climate change, immigration, are common, and therefore they demand shared solutions. We're all in the same boat together, and COVID teaches us that. It's not a Tel Aviv virus, a Cape Town virus, or a Tokyo virus. It's very soon a global virus. This is our third in a series of big lessons from small nations. We talked about how Denmark is achieving a pathway towards carbon neutrality by 2025. Last week, we talked about how the Dutch have the best pension fund systems in the world. These smaller countries are exposed to exogenous forces and therefore must adapt, and they must experiment. This is the case we have today in Israel. We know that over 60% of its population has been vaccinated, by far the highest percentage in the world, also the quickest, and the magic is just starting to begin. You know, whether it's in terms of deaths, hospitalizations, COVID cases, everything's starting to decrease significantly. So I think what we'll do, that's just sort of a short introduction. I'd like to introduce you to Bob Drake. He's the vice chairman of the executive board of the Weizmann Institute of Science. Thank you very much, Bob, for joining us, and thank you, Weizmann, for co-hosting this event.
Well, thank you, James. Much appreciated. Hello and good afternoon, dear friends. I hope that everyone is doing well and staying safe and healthy. 2020 was not an easy year. COVID took over our lives and has affected our day-to-day activities. While Israel is a small country, they have handled the vaccination situation admirably. Israel ranks #1 in the world in vaccinations per capita. More than half the population, 4.6 million citizens, have been vaccinated as of January 29th. This stems from Israel's excellent collaboration with Pfizer early on, and especially in the procurement of enough doses. There has been a systematic, rigorous, and risk-focused approach to vaccine allocation to citizens, including 150 vaccination centers in the country and a goal of vaccinating 250,000 persons per day. This work has been truly amazing. I am pleased and proud that we have been able to collaborate with the wonderful nonprofit organization called S8 Nations, who have their headquarters in Zurich. As you know, EQUIS, the European Committee of the Weizmann Institute of Science, of which I am the proud chairman, is also based in Zurich. We include 12 societies throughout Europe, as well as a Young European Business Club, WYEN. I find some very interesting similarities between the S8 and the EQUIS visions, approaches, and solutions to the world's relevant problems, and am delighted with this joint enterprise. I would like to congratulate you all and wish you further joint collaborations such as this one. I encourage you to remain involved in basic science for the benefit of humanity. Thank you.
Thank you, Bob. Now we're going to move towards the front. We'll be talking to people who've been directly involved with the problems, the obstacles, the solutions, and the achievements. We're starting with Professor Ron Balaser. He's the director of Klatit, Israel's largest healthcare organization. He's an advisor to the WHO, and he's a professor of healthcare policy at Ben-Gurion University. Floor is over to you, Ron.
Thank you kindly, James, and it's really a pleasure and a privilege to be here today. I was asked to kind of briefly cover at the beginning some aspects of the Israeli healthcare system that might be pertinent for the discussion about COVID-19 and the vaccination campaign. So just as a broad umbrella view, Israel is a country of a little over 9 million people with universal healthcare. Every citizen is entitled to a very wide basket of services that is provided by law and regardless of any payment. And it is provided by a set of 4 organizations called the sick funds that you have to choose between the 4, and you usually stay there in about most of the cases, vast majority of the cases, from cradle to grave. These organizations serve as insurers and as providers of care, and they are fairly large, logistically sound organizations. This will prove very useful when we'll talk about the vaccination campaign. And so these 4 sick funds are really focused on providing proactive, community-driven care to their patients. It's not about hospitals, it's about community clinics. If we'll take Klalit as an example, Klalit is the largest of these 4 healthcare organizations, and it is directly responsible for the care of over half of the Israeli population, about 4.7 million people. And it provides care through a set of 1,500 clinics all around the country, from the far north to the far south. And Klalit is also unique in the fact that it also has about 1/3 of the acute hospital beds in the country. So altogether, in a single organization, which is the largest employer in Israel of any type of organization, Klalit is a very large organization that is capable of doing massive care provision on a daily basis. Which brings us one more thing that I would mention about all 4, that they are heavily digitized. And Israel has had electronic medical records for over 20 years now, and all of those 4 have full electronic medical records, and everything is digital, and nothing is done by basically pen and paper or facsimile machine. So back to the beginning of the crisis. So we have been trying to utilize these core advantages, basically, for the benefit of our patients from the early on. At Klalit, for instance, even in last March, we had a predictive model created de novo in real time and used it in order to provide our patients and identify the patients at highest risk of disease deterioration. And we have proactively approached those patients and told them to stay at home and receive digital care instead of coming to the clinics. And thereby we have helped them in preventing preventable morbidity. And one could see that overall, the case fatality rates in Israel of those patients infected, the percentage that have died, is amongst the lowest of all countries globally. And that would be attributed both to the fact that the country is young, to the excellent care in the hospitals, but also to this proactive care that it provides to our elderly and to our population at risk. Fast forward to the vaccine campaign. When we have gathered that the vaccination campaign is imminent and that vaccines will be approved and will become available, and we knew all the fastidious conditions in which they have to be logistically transferred and used, we have geared up a system that was involving both the Ministry of Health and national logistical approach of collecting the vaccines from the airports to the specialized freezers that's required to keep them at the low temperature that's required, from where they have been mobilized to vaccination clinics that were used by or operated by the HMOs, by the sick funds. Now, I will now detail a set of I think, unique modalities of this vaccination campaign that could be useful to consider. First one was, we had the early advantage that we are a small country, geographically condensed, that made logistics a little easier to transfer. We're also a younger country, so our 60 years and older is a smaller subgroup as compared to the rest of the world. So we are able to say right now that we have reached over 90% of our 70 to 79 years old in the country are already vaccinated, which is, I think, a good example of what can be done. It's about 85% over the age of 60 that have been covered, and the vaccination campaign still ongoing. At its peak, we had 250,000 doses provided in a single day. Nowadays, some of the vaccine recipients are first dose, and about 2/3 are second dose, because we're now in this ongoing second dose campaign. Now, what have we done to make this happen? So I talked a little bit about the logistics. I will also mention that in the vaccination campaign, we have from very early on have created a system that allows us to be very simple. So we could have had a very specific subgroups of interest and to identify patients at higher risk and lower risk. We chose, because everything is digital, but we chose simplicity. And we had a very simple approach in which we said 60 years and older and healthcare professionals first. And only when that group was well covered, we went to the next phase and we said, okay, now we go to 50 to 60, then 40 to 50, and now it's 16 plus, and everybody can approach. So simplicity in the indications, and that was one point. The second point is that we had our logistics digital capacity to be able to create online appointments very early on through the apps of every patient. They could have their appointment to a vaccination clinic and come in, and that was very helpful in making things orderly. And the fact that we know how to outreach to our patients was helpful. The third point that I think that's worthwhile mentioning is the agility. We try to be exceedingly agile in the way we have done the actual vaccination clinic operations. And despite there were clear indications, towards the end of the day, there's always leftovers. So once you begin to see there's leftovers, you open to all. Even in the time we had the very clear indications, only 60 years and older, we very early on said, at the end of the day, no, we will disseminate through SMS, through emails, through social media, at this and this clinic, at this and this time. It's also, everyone is being served. Come in and flock in and stand in line and come and take the vaccine, no matter how old you are. As long as you're 16 years old and older, you can come in. So this really helped us to have a very low rate of attrition, less than 0.1% of the doses destroyed because of this very agile approach. So this is, I think, something that's helpful.
Ron, do you think there was a point when you had to actually get the confidence of the public and society actually to participate in the community engagement? Could you just speak about maybe that aspect? Was there a tipping point?
Sure. So as we all know, it all depends on adherence, compliance, willingness to participate, acceptance. And if you want to get there, what you need is to talk directly to the public. And we chose the very transparent approach from early on. We said things as they are. When we weren't sure, we said we're not sure. When we knew something scientifically, we said it. And so the public, I think, was fairly trustful in saying that, we know the pros and cons, we know what we don't know, and we can make informed decisions. And that helped us. Another thing that helped is that there was a lot of outreach to the different communities with social, basically with cultural adaptation of the messages to the different sub-communities in different languages. And we worked a lot with community leaders. To give one example, for instance, I spent time going to ultra-Orthodox shuls and lessons and set with the scholars there to provide very detailed explanation. They actually grilled me for 2.5 hours in very tough scientific questions. And when it was done, the leader, the rabbinical leader there said, okay, I'm convinced these vaccines are effective enough and safe enough that I will give a rabbinical verdict that would tell everybody to go ahead and get vaccinated. And, you know, chief figures in the ultra-Orthodox community got vaccinated first, and that showed the way to the others. And that's why we had an increasing uptake in this subgroup that was very difficult to attain at the beginning. So I think that is exceedingly helpful. You have to outreach to each and every subgroup in the community in order to do that.
Virus or the vaccination?
Sorry?
Who do you think will win this, the virus or the vaccination, this issue of the mutations, etc.? Could you just talk about that?
With pleasure. Look, this is the big question right now. We're really debating. We have a serious problem right now. We have the third wave, and we have by now dominance of the UK B117 strain, which is really causing a lot of trouble and a lot of disease dissemination. And even the lockdown couldn't contain it with an R below 1. So these are tough times. As it is right now, a virus wins because of the quick dissemination. However, we are keeping hopeful, as if and when the vaccination campaign will continue, the vast majority of the risk group over the age of 50 will be covered. And that could happen in a matter of 2 weeks, basically. And a good proportion of the rest of the population that is adult will get vaccinated. This will do two things. One, it will reduce the burden on the hospitals because it will reduce the severe cases. And in parallel, these vaccinated people will serve as an epidemiological barrier that would reduce the reproductive number, would reduce dissemination, and by itself help us have a more normal life habits that are able, on one hand, to maintain our social activities, and on the other, contain the virus from exponential growth, as we've seen in many countries where the UK variant has become dominant.
Excellent. Okay, Ron, stay with us. We'd like to get you involved with the Q&A, but we have to move on to the next speaker. So, Rizdan, it's over to you now. Would you like to chime in? You're muted, Rizdan.
Hello, James. I'm honored to be here, so thank you for having me. I'm from Maccabi. Maccabi is the healthcare services that is the second largest after Clalit, the fastest growing HMO in Israel. Maccabi provides care to 2.5 almost million members, which are 25% of market share, 25% of the population. We have 9,000 employees, 5,500 physicians. Maccabi also owns Asuta Medical Centers, the largest private hospital network in Israel, with 13 facilities all across the country and one general hospital in Ashdod. Maccabi has contracts or ownerships of over 700 pharmacies countrywide. A little addition about the organizational structure that contributes to the vaccination process. As Ron said, the HMOs work by virtue of the National Health Insurance law. All Israeli citizens, 100% of the population are health insured through that law. Citizens have the right to choose their HMO, to move from HMO to HMO, and the HMO provides the health services included in the National Health Services Basket. This basket is declared once a year by a special committee after a very special process of decision making. HMOs, it's important to say, are budgeted per capita, taking into consideration, of course, the age, gender, and distance from centers of population and the healthcare services. As a result, there is an inherent competition between the HMOs, which motivates everyone to provide better services to their members. All HMOs provide maximum accessibility of vaccinations to their members, and the result is that we have over 300 vaccination centers countrywide in all HMOs. HMOs also recruited and trained staff members, mainly nurses, but also paramedics from the ambulance services and the military forces, and that is the infrastructure. And then is the process. The Ministry of Health, of course, provides the policy and the instructions. HMOs recruited staff members with minimum waste policy of the vaccine.
So Weizmann, why don't you maybe you could just share some of your own personal experiences at Maccabi. You know, what have you actually experienced during this COVID pandemic?
Well, we see not only in Maccabi but in Israel, we see the social mixture is obvious. In Maccabi, especially in the north where I come from, we have secular Jews, ultra-Orthodox Jews, immigrants, Muslim Arabs, Christian Arabs, and Druze, and it creates a mix that dictates our approach to care. Our challenges are the cultures, different cultures and beliefs, different spoken languages, and different social media and TV channels that are used. We have to be always tailor-made in our approach linguistically and culturally. And there are certain groups that we need to be proactive and reach out in order to take care of them. For example, in the corona vaccination, in the COVID vaccinations, we have telephone centers, telephone service centers that reach out to the Maccabi members and to schedule an appointment and to do the explanation for a specific population. And that is how we do the policy of the minimum waste of the vaccinations. If I think about the leading factors of the success in the vaccination process, I think about the accessibility of the vaccine centers, really small centers, but everywhere. Despite the logistic challenges, it's important to improve the compliance. Also, adaptability to several social groups and the local leadership and cooperation with the community.
Okay, terrific.
For example,
I think we have to we're a little bit running behind schedule. So, but if you have a few last words you'd like to say, but it's up to you.
Okay, so I really think that it's about local leadership. Okay. The cooperation with the community, the accessibility and the adaptability and the great staff members. We really have great staff members and managers, local managers.
Okay, terrific. Thank you, Weizmann. So next up is Professor Roy Ozeri from the Weizmann Institute, one of the leading research centers in the world with the highest per capita number of peer-reviewed scientific papers. And he'll talk a little bit about the primary research function and its contributions towards the pandemic.
Thank you very much, James. It's an honor to be here. It's also an honor to help hosting this seminar. I was asked to give a little bit of a description of the way we as a very basic research institute could harness the capabilities of our scientists in trying to find a way to help mitigate and alleviate the impact of this pandemic. As I said, we're a basic research institute. We're not affiliated with clinics. You know, we don't have practicing medical doctors apart from those who do, you know, scientific research in our research laboratories. Nevertheless, and I think for us it was inspiring to see as management, very quickly after it was clear that this is going to be a pandemic with severe consequences, I think sometime in March, we realized that we had 60 to 70 initiatives on campus of scientists who are trying to come up with one way or another to battle the COVID pandemic. I should mention that prior to COVID, we had very little virology research on campus, even though we have a rather big immunology department and very good immunology research. Virology and infectious disease was not at the focus of research at the Weizmann Institute. Nevertheless, 65 or so research groups really dropped their regular research and focused all their efforts onto trying to find an answer to COVID. And you could see really efforts coming from clearly biology and immunology, you know, life sciences at large, biomedical chemistry, but also people from computer science who are using AI tools to try and help, and, you know, people who are single cell genomics expert who came up with ways to perform COVID tests more efficiently. So there was really a spree of effort, and creativity. We very quickly understood that we need to support that as management, both in terms of the physical resources that these research groups need, as well as financial, and that's also the reason for us going on a very quick fundraising campaign to help support the activity of these groups. And I think that if you look now, we're 6 or 7 months or even more, so almost a year later, and you look at the things that came out of these research efforts. One example I can give, and Professor Ran Balitzer, I'm sure, is very familiar with it, is one of our scientists, Ran Segal, came up with a creative idea of identifying outbreaks of the disease in Israel. Later on, this method was also used abroad, identifying outbreaks of the disease. Instead of using PCR tests, which are not just costly, but they're also time-consuming, he used questionnaires that could be disseminated to the population very quickly and very effectively through cell phone apps and emails. If you ask people about how they feel, maybe on a single person level, you're not able to detect symptoms on COVID. But if you're trying to look at neighborhoods or towns, it's relatively simple, using advanced computational tools to identify whether an outbreak is coming or not. And with this tool, Israel was able to identify outbreaks of the disease earlier than the PCR tests could identify. I think another example that I like a lot is an example of another scientist at the Weizmann Institute, Nir London, who is a biomedical chemist. He very early on decided to perform a crowdsourcing of his science, if you like, to try and come up with quick drug design. So based on the structure of the protease that he was able to get actually from colleagues in China very early on in February, he designed small molecules that could adhere to the protease and inhibit its action. And then by using these small molecules, he outsourced these initial leads, if you like, for drug design, as well as his computational tools. In partnership with Oxford University and Sloan Kettering in the US, they actually outsourced this information to the crowd of computational chemists, and very quickly were able to come up with larger molecules that could be used as a drug in order to inhibit the action of COVID. And today, and even a couple of months ago, they moved into clinical trials in animals, and really squeezing a trajectory that could have lasted years into several months. So I think for us, when we look at the activity at the Weizmann Institute, I'm very pleased with the agility and the quickness with which our scientists were able to steer their research from whatever they were doing pre-COVID to battling COVID. And for me personally, I think that is that even an institute like ours, which is a blue sky, curiosity-driven research, can become very focused. And I think one of the reasons you can become very focused and very flexible in your ability to steer research in a direction that you feel is important is exactly because you're used to do whatever you like to do. In other words, I think that curiosity-driven research is very flexible and very agile, and therefore can rise up to the challenge very quickly.
Thank you very much, Roy, and stay tuned for some Q&A afterwards. Thank you very much. So next up, we have Professor Afek, who will speak to us, also a leading figure in the Israeli healthcare scene and also in the global scene. Welcome, Professor Afek, and we look forward to your comments.
So thank you very much for your invitation. I'm quite honored to be part of your initiative and to try to share with you our knowledge of how things can be done and how we can be effective in sharing our information with the rest of the European countries and the rest of the world.
Just to say, Arnon is the head of Sheba, which is the largest hospital in Israel. He's a former head of the Israel Ministry of Health, and he's a former governor of the OECD Health Committee. So just to give you a sense of his credentials.
Thank you very much again. I'm flattered, but thank you. Let me share with you some of the reasons why I believe Israel has been so successful in our vaccination program. And I think that, as stated by all the people who spoke before me, are the fact that we based our system on it's a public healthcare system, and which provide, I think, excellent care for all the people of Israel, for all the inhabitants of Israel. It was ranked 6th in the world by Bloomberg as one of the most efficient systems, and described by the OECD in 2012 as an enviable healthcare system among OECD countries. Our hospitals are very, very advanced, and my hospital, Sheba Medical Center, was ranked by the Newsweek as the 9th best hospital in the world just a year ago, based on its capacities and the spirit of our people, to which I will come back later. So the first reason is the public healthcare system. The second reason is our emergency preparedness. We are used, unfortunately, I must say, to deal with emergency situations. So if you take into account the COVID-19 is no different than other emergency situations. So you are used to work together. We are used to work together as a single system headed by the Ministry of Health and run together. So whether they are the hospitals, the healthcare funds, we all work together. We are all coordinated, and we share our efforts to care in the care of our people. The managers of our system, many of them have military background. So we know how to operate our system also in emergency situation. You can work in day-to-day life in order to take care of your patients, and also now we all join together. Another issue which is very important is the spirit of our people, in the sense that you can find a very low-ranking people who are not very high in the system, that take upon themselves decisions. They don't only, and they can operate system which in other cases will be very complicated, because there is an informality in the way we run our system. Our logistic capacity, I think that Professor Balitzer spoke about it before, and the other people, is quite remarkable. It's true that we are a small country, but we have everything within our own country. We have the logistic background that enable us both to store as well as distribute the Pfizer vaccines, which need -70. It's not something which can be a solution to all countries of the world. I think there are very few countries that can use the Pfizer's vaccine. We are heavily digitalized system. We share our electronic medical record throughout Israel. All places, all healthcare funds, all hospitals can share in a secure way, in a personalized, keeping personalized, of course, personal safety. But again, all the system is computerized, and we can share all the data. The innovative spirit of our people is quite remarkable. For example, at the beginning of the corona epidemic, one of our residents, a second-year-old resident in orthopedic surgery, together with his friend from one of our top intelligence unit in the army, found a way in order to transform a non-invasive ventilation into a ventilation machine. A BPAP was transformed into a ventilation machine, just adding to Sheba another 100 ventilation machines, which were really, I would say at that time, in highly demanded.
Because maybe just a couple of words on how you were able to build trust within the community. Just a few.
Well, first, it's a huge task. I think that Ran described it before. You don't know how many times a day I'm being interviewed in the different type of media. I'm speaking about TV. I'm speaking about the radio. Also, radio stations designed and heard by different minorities in Israel, and we all continue, both Ran, myself, and the rest of the I would say the leading physicians in Israel we keep up transparency. We tell the people the truth. I always tell them, look, I don't know what will be the long-time effects of the corona vaccine, but the one thing I knew for sure, and for my own department at Sheba Medical Center, that can be much worse than that. And we explain to the people, and people are intelligent. Of course, there's always fake news and fake campaigns, and we've been fighting what we call the false prophets of Corona, all those who say that it's just a fluid public relationship. We've been fighting them throughout the time, and we are having a hard time. But now we come to a very critical point. The elderly people got vaccinated, quite impressive. Now we are getting to the younger population, and the younger population are in many ways reluctant to take the vaccine. And there we will have to do something else. We realize that, we understand that, and we will do differently. For example, we suggested to the government of Israel to try and give benefits to those who've been vaccinated a week after the second vaccine, what we call, they have a vaccination permit, or we call it a green passport. And we want to open culture, to open the different things in Israel for them. You can tell me, look, it's unethical, we with other people we're not vaccinated yet, but now that we enable everyone to get a vaccine, we can vaccinate up to 250,000 people a day. I don't see any reason why not to get special permits to those who were vaccinated in order to create an initiative, or let's say make younger people take the vaccine as well.
Very good. Oh, that's terrific. Just a quick question. Did you survey, there's been quite a lot of success in Asia, places like Korea, Taiwan, Singapore. Did Israel survey other systems and come up with any ideas that you learned from them?
All right. First, we did it all the time. We had webinars from people from all over the world, including our friends in China and in other countries. And what we learned, that Israelis are very different than Chinese people. Very, very different. We are much less obedient. When you tell people to do one thing, they'll tell you, you are wrong. Who gave you? How do you know you are right? I'll do otherwise. So they are, I would say, being a startup nation has its advantages as well as disadvantages. People in Israel will not follow the orders of like people in Asia do. And I can tell you that there are also things we can do much better and learn from them. For example, their control of the gates of the airport and land port in Israel can be much, much better. We should have learned from them and not done like the way we did. It's something we have to improve for the future. And reinforcement of the lockdown was done very badly in Israel, and we should improve it for the future.
Anand, thank you very much. Stay with us for the Q&A. Fascinating comments. Thank you very much. We're now going to move a bit towards the global perspective. We have Professor Clemens Fürst, who's the president of the IFO Institute, which is Europe's largest, most influential think tank. He's also a professor of economics at the University of Munich. He's done some interesting, original, and critical thinking about how to deal with the manufacturing bottleneck and other aspects of the, trying to alleviate this crisis. So Clemens, is over to you. Thank you for joining us.
Thank you. Pleasure to be here. The paper James was just referring to is a paper about the vaccine situation in Europe and the apparent failure of Europe to make vaccines available to the same extent that this works in the United Kingdom or in the US. And what we argue in this paper basically is that the EU has made two, as it were, errors, negotiate too late, and in the contracts focus on tax savings, on saving money, also relatively low prices, and be vague about the delivery dates. Now, being more precise about the delivery dates was a challenge, but what was missing, just because the vaccines weren't developed when they weren't fully developed, and there were other risks when the contracts were made. But our kind of main critique was that there were very few or no economic incentives at all to deliver in time, and maybe deliver even before schedule. Now, this is of course challenging, but there would have been possibilities to write different contracts. For instance, the AstraZeneca as is public now, the AstraZeneca contract specifies that the payments will just be based on costs. So the company has no chances to make profit on this.
So my understanding, I read your paper and also the University of Chicago study, and I was fascinated to see that the estimated benefit of each vaccination is about 1,500 euro, and the estimated cost is 15 euros. So you have a 100-fold benefit in terms of vaccinating the public. And so, it just strikes me, is that not for you kind of an example of a massive market failure? This difference between market benefit and cost, and what could we do to alleviate that?
Well, I'm not sure it's a classical market failure. Of course, pandemics are cases that cannot be, things that cannot be solved only through markets. Of course, it is governments who are on the demand side here, and in principle, markets would work more or less if the marginal benefit from additional vaccines was taken into account. And our point is that this apparently hasn't happened. So governments just they factor in other things, like there's a lot of moralizing going on in countries like my own and in Europe generally about are people allowed to earn money with vaccines and so on. I think that's. But
so your basic point would be if they relax the level of pricing, that would attract capacity and would accelerate buildup of supply of vaccine, and that would help alleviate the problem. Is that your basic message? Or?
Correct. The interesting question is what can be done now with these contracts, and our suggestion was, okay, we have to take these contracts as given. There is a specified delivery schedule at the moment, and why not offer to companies a high premium if they deliver early? This can be done in many different ways, using auctions or just offering money for early delivery. Some people say it's not possible. Well, it's not possible. At least we don't lose anything. So that's our proposal.
Okay, terrific. Stay with us, Clemens, and we're going to move on to Dorit Nitzan, who's working for the World Health Organization, and she also held former senior management positions in Israeli Ministry of Health. Welcome, Dorit. We look forward to your comments from your perspective. Thank you.
Yeah, thank you, everyone, and respectful colleagues, friends. I'm really honored to join and to bring the perspective from the WHO, because we are really at a race. It's a race of a virus versus humanity. And as we all heard, unless we suppress the virus, and we all know that unless we suppress it everywhere, we could end up back at square one. So we feel that everyone can make a difference, whether it's inspiring others, as it's done in Israel, refuting false information, raising money, or simply deciding to stay home and keep distance, wear masks, etc. And of course, to prioritize those at risk, the older, the health workforce, for the vaccination campaign. We see that life is so precious around the world now, and if we are not doing it together, we will not succeed. And we have Israel. Israel is leading globally in vaccinating its population, and it is now joined by others, slowly but surely. As of the 5th of February, 37 countries in the region where I am in charge of the health emergencies, 37 out of 53 have rolled out the COVID-19 vaccines with 35.1 million doses already administered. But globally, we know that many, many more have been vaccinated. It's remarkable. And I think we have to remember that it's really remarkable. Only a year ago, we were living in just the start of something that we couldn't understand when the vaccines will be here. So it has been a blistering pace, but they are also now produced on mass scale. And the number of people who got vaccinated worldwide is now overtaking the number of reported COVID-19 infections, which is amazing. And yet, more than 3/4 of the vaccine had been handed out in just 10 wealthy countries. Almost 130 countries with 2.5 billion people are yet to administer a single dose. So we are at a critical stage.
So we've had a good start, but there's a lot left to be done, isn't there? That's
and
seems to be the message. Okay.
Yeah.
So
We have to also say something about Israel, if you don't mind, James, because
sure, please, yes.
Israel has been doing great, and being the first is also brings with it, as we heard, lots of responsibility, and we are learning a lot from Israel.
So I mean, just on that point, and I'd like to ask Ron and also Professor Afek the same question. You know, what do you think other nations could learn from Israel? 2 or 3, just one or 2 points, very concrete.
Okay, I'll be very brief. One thing that we've learned in the vaccination campaign was the great difficulty in vaccinating bedridden and house-ridden patients because you cannot transfer the vaccine to the homes. And what we've done at the very early point was, first of all, to vaccinate all of their caregivers and all of their house members. So that was very helpful as a first stage. In the second stage, there was a whole set of maneuvers aimed at getting them in specialized ambulances to the vaccination post, provide them the vaccine, and bring them back home. So I think this is one key thing. The second thing that I would mention is that one would need to start with advocacy for the safety and efficacy of the vaccine as soon as possible and continue in all channels, including social media. This is a true fight that is very difficult to win, and you have to work continuously to get that. The final point that I'll mention is the issue of agility. While you have to be very planned and you have to be logistically sound, you have to keep things agile and allow people at the vaccination clinics to run things according to the specific needs of the day, to allow them to open it up to additional subgroups as needed. And through this kind of a balance between having everything pre-registered and making sure that everything is properly documented, to the agility in the logistical and the indication component, you might be able to get this through.
Good. Arno, would you like to add something?
Yes, please. Thank you. First, I would say transparency to the people. People must know everything, even if you have side effects. For example, we have Bell's palsy or other even more serious side effects. Please tell the people and be transparent to them. They shouldn't feel you are hiding things. That's the first issue. The second issue is, as Ron said, agility. But I'm speaking more about our being flexible in the sense that you have your plan, you have your policy, but once it doesn't work, or you have an extra doses of vaccine you can't give to the people you thought, open it up for the public. Use the social media. You know how many they opened WhatsApp groups and Facebook groups designated to where are spare extra vaccines, and these people were interviewed on TV and on radio, telling them how did you find out your vaccine? Where did you round? Now, this helped in another sense. It created the sense that vaccination is something worthwhile doing, even driving 3 hours to a vaccine station where there are vaccines that are available for the people. So this created a whole atmosphere in Israel, which enabled us to vaccinate as well. I'm speaking about using the media. And the last things I believe is that people, you have to rely on your assets. And if your best asset in your country, like us, are the healthcare funds like Clalit and Maccabi and the two, and Mouchedet and Leumit, then rely on them. If you have very good hospital system, use them as well. They can be used both ways. And and if you don't have these two, then use your municipalities or the army, whatever logistic capacity, because at the end it all starts and ends up in your.
We haven't heard too much of companies getting involved, and historically companies have lots of employees. Typically, healthcare is linked to employment. Do you think companies could be doing more? Each of you, maybe also Clemens, if you have any comments on that.
Well, absolutely. I do think companies play a key role here. In the US, several companies have been participating in the campaign. In Germany, companies have their own medical services. They are very much involved in vaccination for the flu every year. So,
do you think they're doing enough, or could they do more?
I think the delicate issue is the sequencing. So who gets the vaccine? So what companies would certainly want to avoid is going like, okay, people who work for Siemens or Daimler get privileged and others don't. So what would happen? What would have to happen is the standards, the rules are the public rules. And the companies would just support this vaccination campaign, but not for their own employees only.
So a need for egalitarian treatment of employees, which makes sense. And just Dorit and maybe the Israelis. Do you think there could be a situation Dorit talks about how so many of these vaccinations have occurred with developed countries and successful countries, but the emerging countries, of course, there's been very little vaccination done. Could you imagine a situation where there might be a task force from Israel that might advise and assist developing countries and how they design their vaccination campaigns?
Yes. I not only that, I think Israel is already doing it, and people around here also support our work with other countries and guide and explain. And I think that this exactly that comes with the responsibility of being the first. And yes, we are very grateful for that.
Arnon, would you like to say something? Or
I will volunteer, Ron. I didn't even speak with Professor Balitzer before, but I know the way he responds. As you know, he heads the team of the National Corona Advisory Board to the Ministry of Health, and together also with Dorit, and I'm honored to be part of that group. So I'm sure that in the rest of the nights we have free, after advising the other people, we'll be more than happy and honored to share our knowledge with any country who would like to learn from the things we did well as from our mistakes. I think it's crucial that we share also our mistakes yeah. And we've done quite few.
Yeah. So Ron, what's been the biggest mistake that people could learn from?
Well, it's hard to choose. There are so many. I think that the one that we should regret the most is that when we, in almost every instance, when we had to do a safe withdrawal from lockdowns, we had a very concrete plan put forward for a gradual, careful process that was ignored within a matter of maximum 2 weeks by the sheer pressure of various pressure groups that wanted to have immediate alleviation of some of the pressures. While I do understand the political pressures and the practical pressures, I think that we're all paying the price now of some of those decisions. And, it's better not to go into a very difficult situation that would require a lot of wisdom to get out of. It's better not to get there in the first place.
Good. So we're going to open it up to questions from the audience, Cara, if you could join us. And if we could keep the questions and the answers short, because there's over 1,000 people listening. So of course we won't do many a service, but we'll do the best we can. So Cara, you're muted, Cara.
There we are. Thank you, James. All right, so looking at the questions, we've got one question from Joe Gibby, and maybe Dr. Balitzer, you could answer the question as it was asked during your time speaking. So the question would be, from the public's perspective, were the vaccination efforts led by science or by government? And what impact do you think this had on the public's reception?
I think it was, especially early on, a healthy combination of both. It had become exceedingly clear that it took a lot of governmental efforts to make the vaccines available, but the scientists and the physicians were put in front in order to advocate this to the public with a lot of personal examples. So people, I myself and Arnon and others, Professor Afek and others, have come forward on national TV and get vaccinated to give personal example. That as a scientist and as a physician, you take the role and you show by example that you trust the safety and efficacy of the vaccines. So I think it was a healthy combination of very clear, transparent scientific evidence in parallel to the efforts that were done on the national level to make this a successful logistics campaign.
Okay, let's take another one, Cara.
All right. We've got a question, I think, from Mr. Afek. And that would be, how did you secure enough vaccine doses for this program? I think this is one of the central questions that people are interested in.
Well, I think that, again, Israel offered Pfizer something that other countries couldn't offer. First, we were so quick in vaccinating our people, and having such a very well-advanced information system, we could give them both a model of a country that can reach as a large number of its, or a vast majority of its population being vaccinated, which other countries couldn't do, so we could become a model for them, and including to record all the side effects and all the adverse effects and give them the information, being able to share with them this information. The third issue, I think, is where other countries, which were much, much slower than us. So I believe that Pfizer, who kept that vaccine for other countries and waited and waited and waited, said, okay, we'll start producing other vaccines for others. And meanwhile, we can give them to Israel because Israel already uses all the vaccines we made. So I think this is a combination of all these three. And also I can say that our Prime Minister personally took care of that. I know because he gave us the honor of being vaccinated in our own hospital, and I helped him during this process, and I learned from him how important it was for him. And he himself showed everyone he was vaccinated on live. He wanted to be the first citizens of Israel to be vaccinated, him and the Minister of Health. It was all on all the shows, and what was important.
So Arnon and Clemens and also Ron, how important do you think this immunity passport or this green passport, how important is that as a goal?
It really, there's two things about the green passport. One is it is a means of providing those who got vaccinated a clear advantage on the personal level from their vaccinated status above and beyond the personal protection that they have. So that helps drive the vaccination campaigns forward. So this is important. The second reason it is important is because any way you look at it, even if the vaccines are not, might be not 100% or even 95% effective in preventing severe illness and infection, they do provide a considerable protection and reduce dramatically the risks associated with exposure and with disease. And so they allow you to have more intelligent, more sustainable, more meaningful settings by which you can open up and reinvigorate the economy during such a crisis. So the combination of tests, the green passports, and local surveillance can allow you to open up the economy even when the overall transmission is still high. Very good.
Cara, other questions for the audience?
Yes, maybe to Mr. Fust or Ms. Nitzan. Ariel Gorstein is asking, how can we ensure equitable distribution without sacrificing too much efficiency? So maybe Mr. Fust, would you like to answer it?
Yeah, I can say something. I mean, there is a certain conflict, but I think it's pretty clear that there are huge externalities. So in a way, there is a general benefit from people getting vaccinated. It's not just a private benefit. And I think this is in the very early phase of the vaccination campaign, the sequence is very important. Vaccinate the weak first. But later, when enough vaccines are available, I think the second aspect comes to the forefront. So you have to organize the logistics and make sure that you get people vaccinated as quickly as possible. And that's why in the second phase, I think one should emphasize the efficiency and the speed.
Good. Thank you. Another one, Cara?
Yeah, this is from more of a global perspective, I think. So maybe Dr. Nitzan, if you would like to chime in here. So this is from JSH. And she's asking, from those vaccinated, what is the percentage of those that still became infected? And what was the effect? And what are the possible reasons for infection? How worried should we be of this trend?
Yeah, so we are actually collecting the information from countries like Israel, and we see that the infection rate of those that were vaccinated in countries like Israel, reinfection is low. And in other countries, we also see that those who are reinfected usually have it easier kind of clinical picture. But there are also other areas, like we're following very closely with South Africa, where the variant there seems to have more, it creates more challenge, and the vaccination is less effective there. We are looking at it closely, and also in other countries. And this is exactly why data are so important. Thank you.
Good. So let me try to sum up, because we're running out of time, and it's been a fantastic discussion, and thank you everyone for contributing. I think, you know, what we've seen is that going hard and going early has paid off for Israel. So, you know, dithering and half measures are counterproductive. We've heard a lot about agility and speed, which seems to be very valuable. There's also a lot of value in vaccination, is the work that Dr. Clemens Fürst has pointed out, that there's just a tremendous value in getting people vaccinated. We know that we're safe only when everyone's safe, so we have a huge incentive to actually do something. We talked about the need for vaccinations at the emerging and developing country area, and what can be done to expedite that process. And we've learned specific things in Israel, the importance of digitalized and predictive models and common information with healthcare systems, and just how dependent a successful vaccine campaign is on the underlying health and robustness of the healthcare system. Arnon pointed out the importance that, you know, through transparency you derive trust, which is a very important feature in gaining acceptance with the community. And again, this idea of community engagement that Ritzon points out, that you have to take into consideration local differences, different linguistics, and the importance of actually executing at the very local level. So it seems like there's quite a lot of national coordination. Anna mentioned the fact that Prime Minister Netanyahu took a keen interest in the whole program, but it looks as though that execution occurred at the very local level, which contributes to success. And of course, from my side, I was delighted to hear that Israel is willing to share their experience with other countries that may not be as sophisticated with their programs, and we all look forward to that. So terrific. And Clemens, I hope you're successful in trying to convince these people in Europe to, you know, to sort of break this bottleneck of manufacturing, because that seems to be the real bottleneck at this point, is getting more capacity to produce more vaccines and to get it out as quickly as possible. So anyway, just again, thank you everyone. Thank you to the Weizmann Institute, Roe, and also Bob for co-hosting this event. We look forward to other events in the future. And thank you for all the participants, and wishing you the nice day and great week. Thank you very much.